Hello, I am Dr. Ravi Mathur, having an experience of 50 years in the medical field. Today I will explain you the symptoms and complications of the diabetes in such a simple way that you understand it properly. The symptoms and the complications of the diabetes depends upon mainly the duration of the diabetes, and the second cause is when the blood sugar level is not controlled properly. The first signs to appear in a person is fatigue, weakness, and tiredness. This is because the body cells are not getting glucose. The glucose is not able to enter the body cells, so they can't produce energy. With the lack of energy, due to the lack of this energy, the body develops fatigue and weakness. Next, very important symptom is frequent urination or polyuria. Blood sugar level is very high, so what kidney does is it tries to expel the glucose in the urine. Since the blood glucose level is very high, kidney has to overwork, more urine is formed, more urinations. So the frequency of urination is increased. Next symptom is increased thirst or polydipsia. Due to the increased urination, frequency of urination increase, therefore it develops dehydration and loss of fluid, so you person feel thirsty. Another sign is hunger or polyphagia. In diabetes, the glucose is not able to enter inside the cells and the cells can't produce energy. So cells have a feeling of hunger of glucose. The cell sends signal to the higher centers that there is no glucose in the blood, so a person feels hungry. Next is tingling and numbness. The high blood sugar level damages the nerve endings, thereby persons have numbness, pain, and burning sensation, mostly in the hands and feet. Next is delayed and slow healings of the wound. In high blood sugar level, they damage the nerve endings and impair the blood circulation to the body parts. Thereby, the cuts, bruises, or the wounds, they heal slowly and very delayed. Another symptom is unexplained weight loss or weight gain. In diabetes type 1, the cells don't get glucose to produce energy, so what the body does, it burns the fat and muscles, thereby losing weight. But in type 2 diabetes, the cells are not getting glucose, there is a feeling of hunger, so person is overeating and gain weight. Another symptom is blurred vision. Diabetes affect the retina of the eye, so the vision is impaired, and diabetes also affect skin, so there are more chances of infection and discoloration. Now the complications. Long duration diabetes, and when the blood sugar levels are not controlled properly, can lead to severe complications. Diabetes can affect almost all the parts of the body. Number one, heart. Diabetes affects heart and the blood vessels. It causes narrowing of the blood vessels, atherosclerosis, which may lead to the angina, heart stroke, heart attack. Next complication is the diabetes affect nerves or the diabetic neuropathy. In raised blood glucose level, it damages the peripheral blood vessels, the capillaries, who supplies nourishment to the peripheral nerves. When the peripheral nerves don't get nourishment, they get damaged, which result in numbness, tingling, burning sensation, and pain mostly in the extremities, hand and feet. Complications can arise in kidney. It's very frequent. Kidneys are mostly affected in the diabetes. The raised blood glucose level damages the glomeruli or the kidney tissue, which leads to the impaired kidney functions. This is a very important complication of the diabetes. Next complication is eye damage or diabetic retinopathy. In diabetes, the raised blood glucose level increases the permeability of the blood vessels, which leads to the leakage of exudates and hemorrhages on the retina, and it also damages the optic nerve. Both of these reasons, a person may become blind. Another complication is foot damage, which is due to the lack of blood supply and damage to the peripheral nerves, numbness, loss of sensations, and wounds may develop on the foot. Another complication of diabetes in gestational or other pregnant women, it affects both the baby and the mother. In baby, because of the diabetes, the baby become big and large in size, and in later life, this baby has a tendency for overweight, obesity, hence they develop diabetes. In mother, they have high blood sugar levels and swelling, edema over the feet, and loss of protein in the urine. This leads to the preeclampsia of the pregnancy. This is a very complicated sign and symptom. This was all about the symptoms and complications of the diabetes. If you liked my talk, please like it and subscribe it. Thank you.